This is Janessa, and you're watching PhilippineNews.com.
Lung cancer is a huge problem, public health as well as a societal problem, because not enough people take care of people who are sick. And
I really have to applaud this initiative by BI for getting a panel of Asian oncologists to talk about lung cancer, specifically in Asian communities. I think first off, there's a lot of stigma with regards to lung cancer diagnoses being a cancer related to smoking. And we know that as patients are being diagnosed, that there is a large percentage of Asian patients who have lung cancer who have never smoked. And what's important to understand is that there are new exciting therapies that are what we call targeted therapies that will help to improve quality of life as well as extension of life in many of these patients who are diagnosed with advanced disease. And thus we stray away from things like chemotherapy, which can cause a lot of toxicities, as we all know, seeing with our patients and our loved ones. So I think the Filipino community, I think there's not a lot of education with regards to lung cancer symptoms and diagnosis and treatment, and I think this sort of panel and event has really allowed us to really highlight the advances in terms of diagnosis and treatment, and highlighting the Filipino community in that initiative as well.
Awesome. Doctor, you talked about there's different types. We need to be more educated. Can you talk about the different types of lung cancer?
Sure. I mean, there are different broad categories of lung cancer. There's non-small cell and small cell lung cancers. This is the first major category. And then within those categories, well, specifically with non-small cell lung cancers, there are different types of non-small cell lung cancers, squamous, adenocarcinomas, etc. And based on those different subtypes, we may want to look at these potential targeted markers on the tumor cell, which then would allow patients to be candidates for these targeted therapies that we've been discussing that have shown much promise.
Doctor, you talked about how there's more treatments out there other than chemotherapy. So can you briefly tell me a little bit about that some more, and the fact that how important it is to understand there's different types, not just the most common one?
Yeah, very good point. So imagine if you were to look left and right of you, and these people look healthy, they're walking, they're talking, they're enjoying their lives. How would you feel if you realized that they were stage 4 lung cancer patients who are on therapies for their cancer, and they're living a full and really meaningful life without a lot of the side effects that we think of with chemotherapy? And traditional chemotherapy side effects include nausea, vomiting, hair loss, fatigue, risk for infections. With these targeted therapies, we're allowed to forgo many of those different side effects. These patients have minimal side effects like rash or diarrhea, which is very well tolerated and managed, and allowing them to have more time with their families and enjoying their life, which is what they deserve.
I got one more for me. We talked about certain things that are kind of that I didn't even know about, and I'm not saying I'm a smart guy, but you talked about how lung cancer is still possible without smoking, and other things like how lung cancer isn't heredity, and the symptoms. Can we talk a little bit more about that?
Yeah, I mean, unfortunately, at this stage, all we know is that smoking is probably one of the highest risk factors for development of lung cancer. And as we've talked about in this panel, we know that patients who are diagnosed with lung cancer, upwards of almost 40% of those patients have never smoked, especially specifically in the Asian community. So how do we find the cancer early? Because we know that possibly early prevention can improve survivability. Well, today, for non-smokers, there's very limited options. But what we're trying to emphasize on this panel is to look out for particular symptoms. If you have a cough, if you have unintentional weight loss, if you're coughing up blood, any of those type of symptoms that are persistent, that are increasing in severity, that are out of the ordinary, you should bring those to the attention of your physician to really understand whether or not they may be related to lung cancer.